Welcome Howard University College of Pharmacy faculty. Today's session will be a review of clinical pharmacology and ClinicalKey, our Elsevier drug reference solution and Elsevier medical reference solution. My name is Ken Stewart. I'm a specialist for our Elsevier drug information solutions, hospital pharmacist by practice background, and I've spent the bulk of my career in healthcare IT as a pharmacy informaticist. The objectives for today's meeting are listed on this slide, and this was communicated to us at Elsevier. I think Juan Pablo was the main point of contact to list these requirements and the objectives for the session. So we will do an overview of both ClinicalKey and clinical pharmacology. We'll take a look at how the information is organized. We'll show you how we support both systematic reviews and randomized controlled trials within ClinicalKey. We'll talk about how we update the contents of both clinical pharmacology and ClinicalKey, and how you would use these tools at the point of care and why we think they're superior to some other databases on the market. We'll talk about the mobile app for both clinical pharmacology and ClinicalKey. And I'm going to share insights in terms of what I've learned. I've talked to hundreds of health systems and hospitals and other segments within the pharmacy industry, retail pharmacies, PBMs, wholesalers, pharmaceutical manufacturers. And I'll try to bring some of that insight into how these tools are used. Then specifically, you asked that we focus on the particular drugs that are listed and the disease state. So I'll do some of the detailed demonstration of both products using these drugs and these disease states. So I've tried to anticipate what is most important to you as I do this. We certainly can schedule a follow-up session, or you can submit questions and we can provide responses, but we'd be glad to do a follow-up if that's valuable to you. So I'm going to actually start to answer a lot of the questions in the previous slide by doing a brief overview of both products, and then we'll go into the demonstration. So clinical pharmacology, you're using it today within your pharmacy student curriculum. And we really appreciate that at Elsevier. We think it's great that you're using our tool as you educate students. As you know, it is a professional drug reference database. It contains all the information to help pharmacists make the best possible decisions about medication therapy. I would say there are three things that differentiate clinical pharmacology from other products on the market. And it's no secret, I'll just, straightforward. Certainly there are other choices, Lexicomp and Micromedics probably being the biggest two that are on the market. Some ways that I believe clinical pharmacology is superior. First, we update the product as much as hourly, 365 days a year. And it's managed by a team of pharmacist experts, and it has very deep and comprehensive clinical content. And I'll just give you a little bit more detail on that. So we do have a team of pharmacists at Elsevier. They're all PharmDs. Most of them are board certified, Board of Pharmacy specialty certified in a particular area of expertise. So we have infectious disease pharmacists and oncology pharmacists and pediatric pharmacists. And I think what's important is they manage the content just in their area of expertise. They're not generalists. So they have very deep knowledge. Most of them have done residencies and practiced in these environments where they manage that content. They manage both the professional drug monograph as well as the patient-facing drug monographs for patient education. Again, we think that's important because it's consistent. It's consistency between what the pharmacist is going to see and what information we're communicating to a patient as we educate them about their drug or their disease state. So that's our pharmacist team who are managing the content within clinical pharmacology. And, on the previous slide, there was a point that drug information changes so rapidly. And I'll just give you one example, a recent example where it was August 12th. We got approval from FDA to authorize the third dose of COVID vaccine for the Pfizer and Moderna vaccines. And you can see the news release from FDA in the upper left-hand corner. In the lower right, if you take a look, this is a screenshot from clinical pharmacology, and I'm in the indication and dosing section. You can see the text there that we've already put in the information about the third dose of the vaccine for immunocompromised patients. And our revision date was 8/13 at 8:49 a.m. So FDA approved on August 12th. our revision took place on the morning of August 13th. And then the follow-up, the CDC on the 13th, then also agreed on the third dose for immunocompromised patients. So an example of how quickly we update clinical pharmacology, and we think that's an advantage over some of the other products on the market. We also believe that the way that pharmacists use clinical pharmacology is aided in the way that we search for the information and the way that we present that information. And we'll show that during the demonstration. You could see a number of different ways or use cases for clinical pharmacology on the left. What we do is really to be able to search the database and make it easy for you to find what you need. We call that speed to answer, and then absorb that content. We also have very deep information within clinical pharmacology. And this example that I'm showing here is for gemcitabine. And our pharmacist editors, when it's an off-label use of the drug, and that's this case. So this is gemcitabine being used in combination with cisplatin. You could see there's a strength of recommendation. In this case, it's a green light, a strong 4. And then below that, detailed level of evidence. And if you clicked on that, you'd actually see all of the articles that our pharmacist editors reviewed to come to this conclusion. So I like to think about clinical pharmacology as being both the dictionary and encyclopedia. So dictionary meaning that I can get summary information when I need it, the encyclopedia when I want to go very deep. And this is an example. We do have a mobile app for clinical pharmacology. It does run on a phone or a tablet. It is updated every night as long as you have a Wi-Fi connection or a cellular connection if you'd like to do that. And then the data is stored locally on the device. It uses about 2.3 gigabytes to store the data. And what that means is then if you don't have a Wi-Fi connection or a cell connection, you can still access the data on clinical pharmacology. Now, I will say the mobile app doesn't have all the features and functions of the web-based version. It has, well, let's say are the most frequently used functions on the mobile platform. Let me introduce ClinicalKey. So ClinicalKey is our medical reference solution. Traditionally, it's been used by physicians, but more frequently, it is being used by nurses, pharmacists, respiratory therapists, other healthcare professionals who need to understand more than just the drug therapy. They need to understand the overall disease state. What is the diagnosis? What is the treatment, pharmacologic and non-pharmacologic treatment? What are the outcomes? What is the patient disposition? And that's all the type of information that we have within ClinicalKey. It's commonly used not only by practicing clinicians, but also students. So here, mostly medical students, but certainly applicable to pharmacy students as well. And in fact, I think you're using ClinicalKey, at least to some degree, in your curriculum today. So the need for ClinicalKey from a pharmacist perspective, I think, is that pharmacists are practicing in more advanced roles, more advanced clinical roles than ever before. And again, they need to understand. So I'm talking about pharmacists in some cases who are running in combination with a nurse practitioner, a diabetes clinic, anticoagulation clinic, a pain management clinic. They really need to understand the entire disease state, diagnosis, and treatment, because they're making decisions about drug therapy in collaborative practice agreements with physicians as they see those patients in the clinics. And I think that's a great example of how ClinicalKey can provide all of the information that's necessary to understand a disease or a condition. So within ClinicalKey, I've listed here the contents because we're very strong. So what differentiates ClinicalKey from the other products on the market? And again, I'll just be straightforward. UpToDate is one of the other medical reference databases on the market, as well as Dynamed. There are some others, but those are the two major competitors that we see. We think the advantage of ClinicalKey is that it provides both the synoptic content or summary information, especially to treat a patient at the point of care, but it also goes very deep. And the very deep you see listed here, 996 full text reference books, 704 journals published by Elsevier contained within ClinicalKey, 337 procedures consult. I won't read through the rest of the list, but I will mention over 30 specialties. So we cover oncology and infectious disease and so forth as specialties. So that's the advantage. I think very deep content. When I think about up to date, it's high level synoptic content. You won't find the type of detailed content and coverage of specialties that you see within ClinicalKey. ClinicalKey also can be used on the mobile device, and in this case, it's a little bit different. So ClinicalKey, we don't download the data to the device. We don't store it on the device. Rather, you do need a Wi-Fi or cell connection to be able to access ClinicalKey, but you can use all of the functions. So anything that you can do on the web-based version, you could do on the phone as well. So I think, from a pharmacist perspective, ClinicalKey really, again, gives them the understanding that they need around the overall disease or condition, the diagnosis, the overall treatment, to be able to recommend the best possible drug therapy. And, it also provides information that is evidence-based or backed by really strenuous evidence. So it's information that you can count on as you evaluate maybe a complicated patient case and make a recommendation. Or also, I'm thinking from a student perspective, as I'm presenting a patient case or a particular disease state to a preceptor, the information that I can get from ClinicalKey is more than synoptic content. It can show the articles that I reviewed and the clinical guidelines that I reviewed and what I did to really support my decisions or my presentation of my patient. So it's, when I do that type of activity, I need more than synoptic content. You really need to show that you've gone to the next level to understand the most important studies and so forth. And you're using that as part of constructing your case presentation. I'll mention just one other thing, that both ClinicalKey and ClinicalPharmacology can be integrated into EHRs and EMRs. So whether those are health system hospital-based or whether they are being used in a clinic or being used in a retail pharmacy setting, wherever, the information that you see within ClinicalKey and ClinicalPharmacology can be integrated into those popular EHRs. So specifically, some of the most important ones, Epic, Cerner, Allscripts, Meditech, we've done integration with all of those EHRs. So let me conclude there. That is really an overview. I hope it helped to answer some of the questions you had, some of the requirements that we talked about on the first slide. And from this point, I'm going to move into a demonstration of the products. So I'm on the Clinical Pharmacology homepage, and this should be familiar to you. There are a number of different menus and drop downs. So if you click the three dots, you can get to additional options. I do want to point out under resources, two things to make sure you're aware. We do include in Clinical Pharmacology the Harriet Lane Pediatric Handbook. So you have access to the handbook and you can go to the details up. So for example, if I wanted to take a look at the fluid and electrolytes chapter, I can view that directly. We also have available in Clinical Pharmacology. I'm going to go back to the home screen and go back to resources, ToxEd. Now, ToxEd is our toxicology and poisoning database. It looks a little different. The user interface is slightly different, but this is where I would be able to research any overdosages, ingestion of chemicals, poisons, insect bites, snake bites, exposure to plants. Anything that might be necessary as a patient presents in the ED, or if you're in a call center managing calls about poisonings, that information is available in ToxEd, and that's part of Clinical Pharmacology. So I'm going to do a couple of searches, and then we'll go use some of your drug examples that you gave us specifically. But let me just show you a couple of features very quickly. When I search for a drug, it is a global search across our entire database. So if I'm looking for warfarin and I just key in WAR, you notice that it finds anything in the database that starts with or contains WAR. So for example, if you look at the bottom here, Woodward Pharmacy Services, because it contains WAR, comes up in the search under manufacturers. And then the more letters that you add, the more specific the search is. And certainly if you click on the drug, it's going to take you right to the drug, and you'll get to all the professional drug information. I'll show you another example. Now, you don't have to go back to the home screen. Notice there's a search bar up here, and I can search for not only a drug, but for indications for a drug. So I want to take a look at drugs that could be used to treat Raynaud's disease or Raynaud's phenomenon. So when I key in a partial spelling of Raynaud's over on the right-hand side, indications, Raynaud's phenomenon, and click on that. And you can see we break it down. There's FDA approved and labeled drugs. There's only one. There are several that are off-label and recommended. Now, again, I'll emphasize off-label and recommended is managed by our pharmacist editors. So they are looking at the studies that are being published, and they have a rigorous grading criteria. And when they find enough evidence that this is a valid, legitimate use of the drug off-label, they will list that in our database. And these are all hyperlinks, by the way. So if I was curious about how is prazosin used off-label for Raynaud's, it would take me right there. And in fact, it would take me to the dosing information with also references. So in this case, it's a reference to a journal article because certainly the manufacturer can't talk about the off-label use. This one's a relatively old European Journal of Clinical Pharmacology. And in fact, you could view at least the abstract in PubMed, or if there was a journal published by Elsevier, you could view the details in ClinicalKey. I could also search for contraindications. So I want to find all drugs that are contraindicated in QT prolongation. And I'm going to just key in a partial spelling again, contraindications, QT prolongation. I'm going to click on that. And here's a list of all drugs, first, that are absolutely contraindicated for QT prolongation. And below that, drugs to be used with caution in QT prolongation. And again, these are all hyperlinks. I want to search for drugs that could cause a side effect or adverse reaction of nystagmus. And so third box over, adverse reactions. I'm going to click there, nystagmus. And it's going to show me, here's a list of all drugs that potentially could cause nystagmus. The search bar, again, it's global across the database. If you wanted to do something as simple as I'm looking for monoclonal antibody drugs that end in UMAB, I can key in UMAB. And first, under monogram, I'm going to click on View All. Here's a list of all drugs that end in UMAB. So very simple search. I want to find drugs that potentially could be contraindicated in an Asian population. So key in Asian, contraindications, click there, and I'm getting a list of drugs that should be used with caution in Asian patients. So the point here is that our search goes across the entire database. It's a smart search, and you really can find anything within clinical pharmacology using that search. So I want to go then to some specific examples with the drugs that you had asked about. So let's start with Atorvastatin. I'm going to key in a partial spelling. Of course, it's going to present the drug. I'm going to click on Atorvastatin. When I come to the display, this is on the left-hand side, all of the different chapters or sections of the professional drug monograph. I'll point out something that really is applicable in the health system market or hospitals, but you can also use the form checker function. Many of our customers do, who are health system customers, to actually create the formulary specific to their organization. So you can see that we can list a drug as preferred or on formulary or restricted and so forth. You could have policies for therapeutic interchange approved by P&T committee. You can have other notes and links. Just wanted to point that out. As students might practice in the hospital environment, and they might see clinical pharmacology used to display the formulary preferences within the health system. Now I'm going to go into the description and classification. And I wanted to show you, first of all, there's a general description about the drug. And in many cases, it's also a little historical perspective on, when was the drug approved? Were there any specific changes to the drug over time in terms of formulations and so forth? On the left, at the bottom, you could see the classification. So you had asked about hierarchy. You can see that the drug there is listed here. So statins is the lowest level. At the highest level, it's part of the cardiovascular system. And if I click on the statins, it's a hyperlink. So it's going to give me a list of all of the statins, both on market as well as off market. Now I'm going to go back. Remember, you can always use the back browser button to get to the previous screen. I also want to take a look at house supplied. So house supplied is going to give me a list of all the drugs that are both on market as well as off market. So again, off market means the manufacturer no longer distributes that product. You can see that here as an example, off market. Now you can hide the off market. So you're only seeing these existing marketed products. There is a high quality photograph of the product. And we also cross-index the imprint information so you can search for a drug using our drug identifier function. So you can see everything, pretty much everything is generic Atorvastatin. There are still some Lipitor products on the market from Pfizer and from PDRX. If you go to the product, I just wanted to point out we also have pregnancy risk information. So here we break it down by trimester, and in all three cases, we should avoid the use of Atorvastatin in a pregnant woman. I'm going to go back, or let me show you, indications and dosage, one more item for Atorvastatin, then we'll move on to another drug. The indications and dosing are broken down by the particular use case or the indication. So if I click on this box, which is valuable, it's going to show me first the FDA approved and labeled uses of the drug. Below that, it's going to show me the off-label and recommended, again, remember, managed by our pharmacist editors. And then below that, it's going to show me, in some cases, it's off-label but not recommended. So our pharmacist editors have reviewed articles that potentially said you could use the drug for this purpose, but they have not found enough evidence to conclude that it's recommended. So we list that as well. So if I wanted to say, let me take a look at how would I use off-label for atherosclerosis, click there. It's going to give me, and I showed you this before in the presentation, what is the strength of recommendation? So it's a green light, yellow light, red light analogy. In this case, it's equivocal or weak for the use. And then under detailed level of evidence, this will show you the information that our pharmacist editors reviewed. When did it do review? A discussion, and then linkages to some specific references that are valuable. And I think this is another example of where we excel at very deep information for a particular drug within our database. Let's move on. I'm going to go back to the home screen just to kind of ground us. Where are we? Let's take a look at Lisinopril. So I'm going to click on Lisinopril. And I wanted to point out that so far we've been in the all population monograph. So all populations covers everybody from premature neonates all the way through geriatric population. But when there is enough information to warrant the creation of a pediatric and neonatal specific monograph, we do that. So to the right, I can click on pediatric monograph. Notice that the top bar turns green, so you know you're in the pediatric monograph. And then something might be different in terms of the indications for the drug. So if I click on indications and dosing, notice for the treatment of hypertension, we break it down from infants down to children and adolescents. So if I click on infants, here's a statement about how the drug could be used for an infant population. And again, a reference to where did we get that information or what was the most important article that we reviewed. I'll also show you the description and classification because this one is interesting. This is up to 5 levels deep. So if you look, we start at the highest level cardiovascular system, and then at the lowest level, it's the ACE inhibitors. And again, you click there and get a listing of all of the ACE inhibitors, both on market and off market. We also have drug interactions. So there's 2 different ways to check for drug interactions. One is you can click here and you can jump to a particular interaction that is of interest. So I'm curious about the combination of lisinopril and aripiprazole. Click there, it's going to take me to the drug interaction. It's a minor drug interaction. There's not a whole lot of information there. The other way, I think you can check for drug interactions by using our drug interaction check report. So drug interactions, you can actually enter all the drugs on a patient's profile, and you can check not only for the drug interactions, but you can add other considerations. We call them lifestyles. So for example, drug alcohol interactions, drug tobacco interactions. I always include drug alcohol because I'm sometimes surprised how many interactions there are between drugs and alcohol. And then I'll show you one other feature. Let's go back to Lisinopril, called monitoring parameters. It's pretty simple, but valuable as well. So monitoring parameters are going to tell me what usually lab tests need to be checked if a patient is on this drug. So certainly the blood pressure itself of the patient, but you could see creatinine, BUN, potassium, sodium should all be monitored if a patient is taking Lisinopril. The next drug, let's use Metformin, was your other drug you'd asked about. So I'll use Metformin. And I wanted to mention the patient safety warnings. So when you enter a drug, the first thing you're going to see in the bar are boxes that might light up in orange. And Metformin is an example where we have a black box warning. So there is specifically a requirement for a black box warning for this drug. And that takes me to the contraindications and precautions sections and shows me there's a black box warning required for lactic acidosis. It's also on the ISMP list of look-alike, sound-alike, and what we call them confused drug names. So you can view that there. It's also on ISMP's list of high alert drugs in the ambulatory environment. Now, it didn't light up some other criteria that we check for. For example, Beers criteria. So if I select a drug like diazepam, it will light up the Beers criteria because certainly the benzodiazepines should be used with caution or not used at all in some cases in the elderly patients. And here we have very detailed Beers criteria for that drug. And you can see this one actually also highlights or lights up the ISMP alert for high alert for the acute care setting as well. So let me go back again. And let me go back to Metformin, a couple more things I want to show with Metformin. We also have on the right-hand side global drug names. So if there was ever a patient coming in from another country with a drug and you don't know what that drug is, you're trying to do a medication history collection and med reconciliation. And we do have a cross-reference to the names of drugs in other countries. So for example, if I'm looking at the patient brought in a drug, it's called Marivan, and I have no idea what Marivan is. The patient is from Brazil. I'm going to click there, and it's going to take me to warfarin because Marivan, if I look at the global drug names, in Brazil, Marivan is distributed by this pharmaceutical manufacturer in that country. I'm going to take a look at the contraindications. Now we saw a preview of that. Let me go back to the Metformin again. And I'm going to go to contraindications. Now we break down contraindications into first absolute contraindications. And again, the B in the boxes, a black box warning is required for that drug. After absolute contraindications, we have precautions. So drugs should be used with caution in these conditions. Now, these are all hyperlinks. So if I say I'm curious about the use of warfarin in endocarditis, it's going to take me right to that discussion within the monograph itself. And finally, somehow I got off of Metformin. Let's get back to Metformin. I want to show you information on administration. So administration information is specific to the formulation. So in this case, you can see there's oral solid information, and there's oral liquid formulation. And it includes some very simple information, but important. So for example, do not crush or chew. Patient must swallow the tablet whole. Usually administered once daily with the evening meal. For the IV information, for drugs with IV information, it can be much more complex. So I think the administration information is valuable, especially for a student, as they might start to counsel a patient or even assist a nurse in how should I administer this drug. I'll go to another drug you'd asked about, Vascepa. I'm going to select that. And I'm going to go to description and classification. And because you'd asked about randomized controlled trials. And here, I just happen to notice that in description and classification, we specifically talk about some of the studies. So information randomized, placebo-controlled, double-blinded, parallel group study is used within our description and classification. Here's another one, randomized, multi-center, double-blinded, placebo-controlled study. And again, we have hyperlinks to all of the information. So if I go to, let me take this one, click there, and at a minimum, again, I can get to the abstract in PubMed. So if I click on PubMed, it'll take you to the abstract. And I'm going to go into indications and dosing for Vascepa. And I just wanted to show you the different listings that we have. So hypertriglyceridemia is probably the primary reason that we're interested in this drug, since hypercholesteremia was one of the disease states you have to focus on. And here we have the dosing and the references for that drug. So one more thing I want to show you about clinical pharmacology, and there's so much more. I encourage you, if you don't already use all these different drop downs, take a look at them. But I do want to talk about drug class overviews because I think that's really valuable. And so for all three of the drugs that you asked about, we do have drug class overviews available. So if let's say I look at Lisinopril and select that, notice on the right-hand side, there's a drug class overview for the ACE inhibitors. Another way to get to the drug class overviews is from the home screen. And if I go to resources, I've got drug class overviews, and you can select a particular drug class and you'll get the information. I'll show you the details in a second. But let's go back and let's search. I'm going to do statins. So I'm going to do Atorvastatin, select that. It's going to show that there is a drug class overview available on the right-hand side. I'm going to select the drug class overview for the statins. Now, it's going to first give you kind of a summary, textual information about the drug. And then we start to present tables that are valuable because it's a quick way to take a look at how could the drug be used, side effects, and so forth. These are all downloadable to Excel, by the way. So in this case, we're going to say, is the drug indicated for a particular disease state? So across the top, you can see the statins are all listed. In the first column, the different potential disease states. The yes means it's FDA approved and labeled. The yes with the dagger next to it means it's off-label, but still recommended. And these are all hyperlinks, by the way. So if I just click on the yes, it's going to take me to the indication and dosing section specifically for that drug. Below that, we have information about converting patients from one drug to another within the therapeutic category. Now, sometimes it's very direct. In this case, there isn't a direct conversion, but rather we talk about how each of the statins might affect the LDL, HDL, and triglyceride percent change. So I can, maybe a patient is having a side effect. They're on Atorvastatin right now. They're getting some muscular side effects. I want to try rosuvastatin and see if that's a better choice. Here's some information that can help in the conversion of the patient. We also list under comparative efficacy the major studies that we used, and these are mostly meta-analyses that we used in order to be able to come to the conclusions and present the data within the drug class overview. The adverse reactions and side effect table is really popular. So this is a quick way to say, okay, what is the reported incidence of a side effect? So again, across the top are the drugs in the therapeutic class, down the left are the potential side effects, myalgia. So myalgia is reported in 2.7 to 8.4% of patients using atorvastatin. So if you click there, it's going to take you to the detailed discussion within the adverse reaction section. And then there's more information in drug class overviews, drug interactions. We also then list, are there any safety issues? Is a med guide required? Is it part of a REMS program? So I'd encourage you, if you're not already using the drug class overviews, really valuable, especially with the disease states that you've listed. We have drug class overviews available for the statins, for the insulins, for other drugs used to treat diabetes and for hypertension as well. And then I just want to go back, one feature I forgot to mention. If a drug is part of a REMS program, I'll use Suboxone as an example. On the right-hand side, you'll see a box pop up that shows that there is REMS data. And each manufacturer is required to submit specific information for their REMS program. I'll just pick the information from Amneal, manufacturer, and it's going to show me specifically what elements to assure safe use were required, and actually has the document. So if you wanted to see the brochure that Amneal had to produce for the pharmacist for Suboxone, click there, and it's going to give you that information. So we store all of that within clinical pharmacology. So I'm going to stop there with my review of clinical pharmacology, and I'm next going to move on to ClinicalKey, our medical reference product. I'm now logged into ClinicalKey, and this is the home page. If you notice on the upper right-hand side, I'm logged in, and there's a reason that it's valuable to log in because you can access saved content. You can take a look at presentations that you've created using the information. If you were a physician, you could actually get CME credit just by doing searches within our ClinicalKey medical reference solution. Now, I'll show you why I think ClinicalKey is really valuable and a supplement as I research drug therapy. So I'm going to go back to clinical pharmacology for a second. Suppose I'm looking for hypertension, and I can key in hypertension, and I'm curious, I want to find drugs that can be used to treat hypertension. Now, there's various iterations or variations on hypertension. You can see those there. But if I just click hypertension, it's going to be a list of probably 100 drugs. Doesn't really, that's good because it tells me what drugs could be used to treat hypertension, but it doesn't really say, well, what's first line, second line therapy? What are the considerations for one drug versus the other, unless I click on each drug and review that information. And I think that's where ClinicalKey is a great supplement, because if I key in hypertension as a search term, and I'm going to click hypertension there, it's going to take me to a results screen. So what's interesting, if you just take a look at this, I talked about how deep the content is within ClinicalKey. Over 24,000 results available for a search of hypertension. Now, I want to go to what we call the clinical overview, and I'll explain that in a little bit more detail in a minute. But I want to go to treatment. And within treatment, I specifically want to go to drug therapy. So I'm going to scroll down here, treatment options, drug therapy. Sorry, little, try that again. Not sure why the display didn't change. There we go. So within drug therapy, I'm going to have a very detailed discussion about here. If you take a look, oral administration, initial and add-on therapy. It's going to take me through starting with the thiazide diuretics. It's going to take me through the calcium channel blockers, the ACE inhibitors, the ARBs. And it'll take me through, then alpha blockers, beta blockers. It's going to take me through all of the different drugs and a discussion about why might I use them, or how do I use them, and the dosing and so forth. So I always, when I'm researching a disease state or I'm researching the therapy for a disease, I always go to ClinicalKey because it's a valuable supplement to lay out what are all of the treatment options for drug therapy, and then what's first line, second line again. Now, I also always use treatment options because there's more than simply drug therapy. So it's going to talk about what are the non-drug, non-pharmacologic treatments, how do I diagnose and so forth. So ClinicalKey provides all of that. I just wanted to contrast the info in clinical pharmacology versus ClinicalKey. And now we'll go a little bit deeper within ClinicalKey itself. You could see that you could search. Now I do most of my work from the search bar, but below that, your specific areas that you could go into. You could go straight to all the books. Remember, I said there were hundreds of books and over 1,000 journals and procedure videos. That's all right there. If you ever wanted to see what's new, here's content updates. At the very bottom, you can also go to a resource center. And in the resource center, you can get a detailed listing of all of the books and journals and clinical overviews that are within ClinicalKey. So let me start off with hypercholesteremia. So when I look for hypercholesteremia, I'm actually taken to a clinical overview for dyslipidemia in adults. And again, our clinical overview is our synoptic content. So these clinical overviews are written by our editors at Elsevier. So we have physicians, nurses, pharmacists who work on scanning all the literature, the studies, the guidelines to create these clinical overviews. And it'll take you through. Left-hand side navigator shows all the points it takes you through. If you wanted to see how are these constructed, up here, first of all, it'll tell you when was it last updated. So this was updated May of this year. And if you look at the details, it'll tell you, what is a clinical overview? How are they created? Who creates them? What's the clinical experience of the people who are working on these? Are they evidence-based? How are they updated? It even tells you who's the editorial board for these clinical overviews. So a lot of good information there. If you're not using clinical overviews today, I highly encourage them that this is the first place a student would want to go to understand a disease state and how is it treated at the point of care, and then research. If I needed to dive into journals or books or other clinical trials, all of that information is available. So, but under urgent action, if I go to the right-hand side, urgent action is going to tell me what do I do right now for this patient if they present. Another example, let me just go over here because I like this one, diabetic ketoacidosis. So I'm just going to key in DKA, and it'll take me to the clinical overview for DKA. And notice on the left-hand side, when I talked about all these other assets we have, here are the books that are available. So there's over 4,000 journal articles, over 2,300 citations from books, 153 different clinical trials on our database. But I'm going to go to the clinical overview. And again, it's going to show me urgent action. So what do I need to do right now? I'm a new pharmacist. I'm in the ED. Patients coming in with diabetic ketoacidosis. I haven't really treated them before. I at least need to understand what's going to happen to this patient when they come in. And so on the right-hand side, we have a summary of what should be done. I like to go to treatment because in many cases we include protocols. Let me see if I can make that larger. I won't make it larger for now, but this is essentially the guidelines to say, what do I do when a patient comes in? What IV fluids do I need to give? Certainly start the insulin drip, and then also check potassium and adjust potassium if I'm out of range, right? So these types of charts are valuable. By the way, you can add these to a PowerPoint presentation. So from a teaching perspective, you could do that. And when you add it to PowerPoint, it brings along the citation. So you don't have to worry about entering the citation yourself. Let me go back. And I'm going to go back to ClinicalKey again, and we were on hypercholesteremia. So let's go back to hypercholesteremia. And I'm going to go back to the clinical overview. And I'm going to go down to treatment goals, because it's going to show me what are the treatment goals, what are our goals based on high intensity, moderate intensity, low intensity therapy. It's going to show me some criteria to say, specifically what are the levels of HDL that put me into very high to low risk. It's going to show me treatment guidelines based on the American Association of Clinical Endocrinology. It's going to show me below that a discussion of all the different drugs that could be used. So treatment, then I can go specifically to drug therapy and get a very detailed listing of the drugs. Again, we're breaking this down to say, here's the drug. If I want to do high intensity, moderate intensity, low intensity treatment, what dosages of each drug am I looking at? So I like this because even in the drug class overviews, we didn't see a chart similar to this. So I always think of these tools are complementary. I always use clinical pharmacology and ClinicalKey together to get the best possible perspective on recommending drug therapy. Now, we also have, this was interesting since you asked about Vascepa, non-drug therapy and supportive care. So they do mention Vascepa as secondary prevention, patients who have fasting triglyceride levels greater than 1.7 millimoles per liter. By the way, you can search for anything in a clinical overview by using simply the Control F function within Windows. So if I just do a Control F, it opens a search window at the top. I can enter icosapent, and then you can use the down button to get to each reference within the clinical overview. I'm going to go back to the home screen. I'm going to go to hypertension, which was the next disease state. So I'm going to click on hypertension. You can see there were a lot of variations for hypertension. And again, I'm going to go to the clinical overview first. Now, again, if you wanted to go straight to clinical trials or guidelines, you could do that. But I'm going to go to the clinical overview for hypertension. We showed you on the right-hand side, it's got the urgent action that's necessary. I want to go down to within diagnosis, differential diagnosis. So it also will show you what other disease states might you consider when you think the patient might have hypertension. So there's a discussion of the other disease states and why might those be confused with, or why might it actually be one of those disease states and not primary hypertension. Under treatment goals, I'm going to go to treatment goals. And here you're going to see that we have information for newly diagnosed patients, non-hypertensive emergency, based on the 2019 guidelines from American College of Cardiology and AHA. Here's the treatment goal. And then if I go to treatment options and I go to drug therapy, again, you're going to have, I showed this earlier, a very detailed listing of all the drug classes that could be used for treating hypertension, and a discussion of when do you introduce each. Now, I'm going to go back to, I'm going to search for back to results at the top for hypertension back to results, because I want to show you the filters on the left-hand side. So first of all, journal articles. So you can filter and say, I just want to look at journal articles, and you could decide, do you want full text articles only, or do you want articles also that have full text and a Medline reference? And the articles are listed there. If it is a journal that is published by Elsevier, then you will have the ability to link to the full text article. Oh, I'm not sure why I got that error there. Let me try one more. All right, I'm not sure what's happening with my browser right now, but I guarantee you can get to the full text article if it is one that is published by Elsevier. You could specifically look at books, you could look at guidelines, you could look at images. So clinical trials, you'd asked about the different information. So I'm going to go to clinical trials. There are 497 different clinical trials available. And then you could say, by what date? Maybe I just want to see clinical trials in the last 6 months. So now I have a listing. There were 157 different clinical trials in the past 6 months. And these look like they all would be if I just select one. These will probably take me to a general discussion or a link in PubMed. The other thing I'll do, let me go back up. I'm going to deselect clinical trials. I'm going to go into journal articles one more time. So for both journal articles and clinical trials, you can also pick what's called the activity type. So under activity type, you can say, do I want to take a look at just meta-analyses? Do I want to take a look at narrative reviews? And let me click on journal articles again, because we also support systematic reviews as well. And I'm not seeing those appear here, but you'll find 3 different types of content. And so I could say, I just want to look at these meta-analyses. Click on that, and it'll present the 2 articles that were found. So this article type is going to answer your question about how can you see a systematic review versus a randomized controlled trial versus a narrative review. So let me go one more time. Let me deselect journal articles. Go to clinical trials. And go to activity type. I was hoping to see the systematic reviews. They are an option. So, last disease state that you asked about was diabetes. So I'm going to show you. Now I could certainly search for diabetes, but I want to show you one other feature of ClinicalKey that I think is valuable. Up here on the right-hand side, if I click, I can go to save content. So I previously searched for the clinical overview for diabetes mellitus type 2 in adults. So if I go to save content, it's going to tell me, here's the things that I've searched for and saved, so I can go right to my clinical overview. So if it's something frequently that you want to come back and reference, you could save that. And you could save it simply by clicking on this star here in the upper right-hand corner. Now, if I look, one of the things I wanted to point out about the clinical overview or the number of references that we use to construct them. So if I go to the very bottom of the clinical overview, it's going to give me all of the references that were used to construct this overview. And in this case, 170 different references were used. Now you can view where a reference was used in the article. So if you say, I want to see where was this reference used, it's going to show me that. If I'm in the clinical overview, you notice it might be a little difficult to see, but there are hyperlinks. So I'm curious about number 32, and I want to actually see it as in the cross-reference. It'll take me out then. In this case, it takes me to the abstract in PubMed. So it's going to show you that information. If I go to, let me close that out, treatment goals. Here it's going to give me a fairly simple chart, but I still think valuable. So what are the steps for treating sequential stages for therapy in type 2 diabetes? Right, so we start with basal bolus, then step prandial, and so forth. Adding oral agents. So it gives you an overall view of how do you treat the disease state. Again, this is a chart that could be downloaded into a PowerPoint presentation. Sorry, I accidentally closed ClinicalKey. So let me bring that back up. And again, I'll go to my saved content. Bring up my clinical overview. And I want to go to drug therapy. So as I go down, I'm going to go to treatment options, drug therapy. And here it's going to give me again, what are the different drugs that I'd want to consider, starting with metformin. So I believe you did ask about metformin as well, one of the drugs that you were interested in, and we did cover that. So as I scroll through this, it's going to take me through all of the different options to treat the patient. It will get to the insulins. Let me scroll down a little bit and get to the insulins. I want to show you some of the charts that we have. First, other injectables for type 2, non-insulins. Then we'll get to a very detailed discussion of the insulins and some charts that I think are valuable. Let me scroll down a bit. Here is insulin therapy for type 2 diabetes. It's going to talk about the type of insulin, the specific drug itself, and then information about onset and peak and so forth, and some comments. Below that, there's a chart which will lay out oral therapy for type 2 diabetes. So these charts to me are very helpful when I want to understand, again, the overall treatment and the treatment options for a patient. Last thing I'll show you, I'm going to go back to, I'm going to search actually in this case. I'm going to search for diabetes. And I'm going to go, let's see, should be quicker if I go back to my saved content. And I want to go to, let me do one more search. I want to expose the content on the left-hand side and show you, if I click on more sources, clinical calculators. So clinical calculators, we certainly have drug calculators, but we also have other calculators that are valuable for a disease state. So you can see calculators, risk of acquiring diabetes mellitus, stroke risk in type 2, stroke risk in male patients using the Framingham data, diabetes risk score. So each of these calculators will ask you to enter some criteria, and then we'll calculate the risk score for a patient. So I'm going to stop there with ClinicalKey. I could go on for a lot longer, but I think I've hit the key features within ClinicalKey. Before I finish, I want to show you one more thing. It's not part of ClinicalKey or ClinicalPharmacology. It's a resource. It's a free resource from Elsevier, and it's called the Elsevier Healthcare Hub. So it's available. Just simply go key in this URL that you see at the top, and it'll take you to our healthcare hubs. Now, again, these are curated by our physicians, our pharmacists, nurses, and others. And they focus on particular topics or disease states. So we have a COVID hub. I guess interesting from our discussion today, a hub dedicated just to diabetes, a hub for hypertension. Another one that's popular with pharmacists is the pain management hub. And once I go into that hub, it's going to show me, it take you into a particular focus area. It's going to give me all of the most important guidelines. It's going to give me drug class overviews, nursing information, most important journal articles. So I encourage you and your students to take a look at our healthcare hubs, provided free of charge, some very deep information on those particular topics. And certainly the COVID hub has been very popular and helpful to clinicians everywhere. So let me conclude our session for today. Again, I would be glad to take additional questions, or we could set up maybe a live meeting so that you could ask questions and I can show you the features within the products. I appreciate your time today. Thank you.